Hi, Dr. Jorge Peláez here. I would like to talk about a condition which I deeply hate, but on the other hand, I deal with the patients that I deeply love. This condition affects women and it has been causing ravages. And in fact, maybe if you had symptoms that you think might be suggestive, might trigger your mind and say, I had that, or I have a friend who had this, you might want to pay attention to what I have to say. If you're a woman in your reproductive years, and maybe you have been suffering from hair thinning, unwanted body hair, weight gain which has been reluctant to go away in spite of your best efforts and even in spite of having been seen by a multitude of specialists, maybe you have issues with infertility, irregular periods, spotting, maybe you feel irritable, you have breast tenderness, maybe you have headaches. So if you do have some of these symptoms, and on top of that, even if maybe you have been experiencing high blood sugars, you have been experiencing maybe even diabetes, you might have a condition called PCOS. PCOS is short for polycystic ovarian syndrome. And one of the many reasons why I'm particularly interested in this condition is because it affects millions of women. But in spite of that, there's a tremendous amount of confusion and frustration among the victims of this condition because it's very poorly understood, and also oftentimes the treatment is fragmented. Therefore, women feel almost disappointed after a while and after their best trial and after following the recommendations because they don't get to the point where they would like to get. Let's talk a little bit about the history of PCOS. The first time this condition was described in the medical literature was with 7 patients that Dr. Steen and Leventhal had, which suffered from many of the symptoms that we described before. They operated on these women and they did a wedge resection. Through that particular treatment, 2 women were able to conceive. Still, the intrinsic mechanism and all the abnormalities associated with what was later called PCOS were completely unknown at that point. Still, because of the prevalence of this condition, because I can guarantee you can imagine with 5 million women in the US alone having this, I believe that most physicians at some point, or healthcare providers, dealt with a woman experiencing this problem. So they saw the need to try to understand and to identify these patients better. So in 1990, there was a conference, a medical conference sponsored by the NIH, where physicians were asked, how would you define PCOS? How would you call PCOS? So they gathered the consensus, and 2 physicians gathered all that consensus, and basically it was, number 1, women should have difficulties with their androgens, either chemical evidence of abnormal androgens such as elevated testosterone or elevated free testosterone, and or clinical symptoms of that. And clinical symptoms of elevated androgens are problems such as hair thinning, unwanted body hair, and so forth. The next thing that they recognized as important was that these women were having difficulties with their ovulation, and therefore that explained the high rate of infertility in this condition. And number 3, they determined that everything else, it was a diagnosis of exclusion. Everything else should have been eliminated before saying, okay, this particular woman has PCOS. Okay? Now, going all the way to 2003, again, there was a major medical meeting where both European and American medical societies were present. And at that point, they said, okay, let's agree on this. Women should have 2 out of these 3 conditions in order to determine that they have PCOS. Number 1, they should be having difficulties with their androgens, and again, either chemical and or clinical symptoms of a problem with their androgens. Number two, they should be having difficulties with their ovulation. And number three, they should be having ovarian cysts. So 2 out of 3 of those conditions. Still, today we have experts that are requesting a change in the name because, as you can easily see, a significant proportion of women with PCOS don't even have ovarian cysts, yet the name is polycystic ovarian syndrome. In addition to that, we know the prevalence of insulin resistance associated with PCOS, which has not been probably emphasized in previous definitions of PCOS. One thing which was left completely uncovered in those definitions is a very important situation in PCOS, which is something called insulin resistance. So insulin, as I'm sure you know, is a hormone which is produced by the pancreas, which responds to the presence of blood sugar. So every time our blood sugar goes up, our insulin has to go up to allow the blood sugar to make it inside the cells. So what happens in PCOS is somehow there's a rebellion in your body where you don't respond to the insulin the way you're supposed to respond. So the compensatory mechanism from the body is, okay, well, I'm going to be producing more insulin, so hopefully I'm going to keep the blood sugar under control. The problem is insulin is an anabolic hormone, meaning it doesn't allow you to burn fat. And that could be one of the many reasons for which you have been having such a hard time losing weight. So it's not just a cookie cutter approach, and it is extremely important to address every single feature associated with PCOS. And I can tell you that I've seen it over and over and over again in my patients with PCOS. When we use a comprehensive approach, the chances of success go way high. So, as I said, typically women who have PCOS could have a bunch of symptoms, but sometimes maybe they only have a few of these symptoms. And what happens is they go to a specialist. Let's say they have acne, which is one of the features in PCOS. So they might go to a dermatologist, they receive a cream, but still the root cause of the problem, the complexity of the problem is not addressed. Maybe they have irregular periods, so they go to the gynecologist and they receive birth control pills with the hope of lowering the amount of androgens. Still, that doesn't address the complexity of the picture. Maybe they feel anxious, so they go to a psychiatrist. Maybe they have difficulties losing weight, so they went through a weight loss program, which, by the way, none of them tend to be very effective long term because they don't change what's intrinsically wrong in PCOS. Again, we don't know the cause, but we are very aware today of the many abnormalities associated with PCOS. You cannot cure PCOS because we do not know the cause of this condition. Therefore, we cannot go after the ultimate reason for which women develop this problem. But on the other hand, the good news is that we can absolutely treat it, manage it, and hopefully with the right approach, with the ultimate scientific approach, women can have a normal life and oftentimes an optimal life. I do believe that we all have the sacred birthright to achieve optimal health. And through optimal health, we can access our sole purpose. I've seen it over and over again that women with PCOS can definitely achieve optimal health through a comprehensive treatment. As I mentioned before, you might have felt stuck and almost disappointed when you go to your healthcare providers that might have treated one part of your medical problem. So therefore, maybe you received birth control pills and maybe your androgens went down, but how about your weight? How about your other hormonal imbalances, such as oftentimes the decreased production of progesterone? Let's not forget that it's not just the horrible quality of life that sometimes women with PCOS might have, but all the horrible consequences associated with this condition. For instance, there's a much higher rate of diabetes mellitus, much higher rate of cardiovascular complications, abnormal cholesterol and lipids, higher rate of uterine and sometimes breast cancer, heart attacks, and even strokes. I mean, horrible, terrible conditions. So my heart goes out to you, and I will do whatever I can, and I think science is ready to treat you in an optimal way rather than a fragmented way. So how do we treat this? The optimal way to treat this is through a comprehensive approach. What I mean by a comprehensive approach is addressing all the abnormalities and listening to you as a woman more than numbers, okay? So, for instance, first of all, lifestyle, extremely important, and it's a number one issue that should be considered. We know that high quality nutrition with a low glycemic index, meaning those foods that do not allow your blood sugar to go very high, addressing your stress, addressing even teaching you to do relaxation techniques such as biofeedback, improving your sleep, customizing your exercise in a way which is both cost efficient and effective for you. So lifestyle, extremely important. Nutrition, extremely important. Exercise, extremely important. Stress reduction is extremely important, because guess what? You ladies have been extremely stressed. You have seen suffering from this. And then over time, you have been taxing your adrenal glands, your HPA axis, and oftentimes the adrenal glands are not functioning very well. On top of that, everything is connected. So a significant number of women with PCOS also have thyroid conditions. And some of the symptoms associated with thyroid conditions could be sensitivity to cold, low body temperature, difficulties losing weight, constipation, dry skin, puffy eyes when you wake up in the morning. So that has to be addressed. We also need to test the right way, and we need to order the right test, because if we don't ask the right scientific questions, we're not going to have the right scientific answers. For instance, there is a difference between normal and optimal when it comes to hormones, including thyroid. So oftentimes, don't get stuck with the answer that your tests were normal. Well, your tests were normal, but were they optimal? We should be addressing your hormonal issues, and one of the reasons why there seems to be an increased rate of female cancers is because there is a predominance of estrogen over progesterone. Women with PCOS don't tend to produce progesterone in a very healthy way, so oftentimes that needs to be replaced or need to be rebalanced. We also need to address your high insulin level, and we have an unbelievable number of tools where we can achieve that through supplements, through lifestyle changes, prescription medication sometimes. We need to address your quality of life issues, and again, your hair thinning, unwanted body hair, and we have supplements, we have medications that can help for that. We need to address your irregular periods, and oftentimes your insulin resistance. Your insulin resistance, again, can be manifested by a high insulin level, sometimes a high blood sugar, in which don't allow you to lose weight the way you would like to lose it. So the best approach would be a comprehensive approach where we can identify your particular problems within the PCOS, but you're not PCOS, you're a person suffering from PCOS. So we need to treat you with that particular condition in a comprehensive way and assessing all the other associated features associated with PCOS. What are the most important things that you can do in order to achieve optimal health and to bring your health back where you would like to have it and basically beat PCOS? Number one, education, empowering yourself. So make sure you read quality information, because not only information that you're going to see on the web, of course, is reliable. We have a significant amount of information on our website that you might want to check. So read, compare, go to pubmed.org and look at the different papers. Number two, be aware that the most effective way to treat this condition is by you acknowledging that you're worth being treated, that you're worth being, I wouldn't say cured because we cannot claim a cure for this, but you can go back to reaching optimal health. So you are worth it. You are worth investing in yourself. Okay? Number 3, pay attention to what you eat. Be mindful. Read about glycemic index and the ravages that processed food can make in your health. Number 4, seek for support. If you don't think you have enough energy at this point to invest in yourself to make a change, I can promise you, you're worth it. Seek the advice of a friend, a health professional, a counselor, whoever you can think of. And last but not least, we are ready to help you out. But we cannot help you unless you contact us. Please give us a call or send a consult request through our website, and we'll be ready and honored to do our best to help you out. Thank you for watching this video.